But like, it wasn't supposed to be easy yet, right? I hope it wasn't.
For me, it's not, just because I
Oh,
don't
good. The words.
know. I mean, that's
I,
part of the beginning. I mean, it's hard for me to look at somebody and say, that person's pitta, that person's vata is easier for me, but it's not easy for me to do this. So
I have a cousin who's the quintessential kapha. I mean, she walks by you and everyone knows she's kapha. So I selected her. She's so easy. Even her skin is oily. You can, she oozes oil. I'm like, she's the kind that Dr. Stephen spoke about, that's analogy he gave at the airport where the flight is canceled and the vadas go up there and start crying, the pittas start pounding. What do you mean? And the kaphas go and get ice cream. That's her. She's getting ice cream.
Okay. Now that part I was starting to feel a little comfortable, although I flip-flopped a couple people. I was so shocked. I was sure somebody was kapha, and then Dr. Priyanka said, no, they're not, and showed me why. So I thought like, okay, I feel pretty good about that. But then when it gets past that, the words, and they kind of, some of them all look the same. And then like, I just got a little, like a tiny bit overwhelmed, but I'm excited to one day master it. But it's certainly, I was just hoping, since it's the first time we did it, that I really felt like clueless. I kind of felt really clueless. Like I was like, I think it's that, but I didn't feel firm in any of my answers for the homework yet, for this part at all. I hope it's okay to be that place yet, because the words are kind of like, it's like learning a foreign language all over, like Latin class or something.
Yes, earlier you will be a bit unfamiliar with the words because you are listening for the first time. But gradually, when you correlate these words with that identity, when you understand those words and you correlate with that person, then, a deeper sense will prevail. You will understand it more deeply, right? So the words you are hearing words for the first time, but Prakriti Parikshan, or when you analyze a constitution, that is, the constitution is called as Prakriti. So when you are analyzing that will require experience. You need to observe people closely. Just someone, for example, if someone is talking fast, or that doesn't make him or her purely Vata. The circumstances, the condition, everything should be taken into consideration. So Prakriti is the one thing. Then, eventually we will be making you understand about the face reading as well. Like when you see a person through face reading, many of you who must have done a consultation with me, in most of the cases, I read the face, I analyze the Prakriti, and then I analyze the Vikruti, the disease, the disease condition which is there. So, it requires some practice and a deeper understanding. So all of you, it's not difficult, but in due course of time, each one of you will be masters in that, right? Okay. So before I sharing my case history, I want to know from few people who did the consultation that in those 1, 2, or 3 consultation you did, what were the key points which you understood, and what are the things you want to understand more. So when I write an email, I will be more specific with it for your understanding. So this basically for me, like when I am doing a case, like a case consultation with you all, what were your pickup points, what were your takeaway points, and what you want to focus more. So we'll start with Mary first. Mary, you want to start? Yeah.
Okay. Yes, one of the takeaway points that I got, well, the face reading alone was interesting to me. To of the cases that I presented with you, one person I knew well, the other 2 I didn't. And you were so spot on with the person that I knew well right from the beginning. And I was impressed with the way you were able to do that. And having said that, I also tried to do that with the other two. I went back over those cases to see, and I can say that the thing that stood out for me the most was their mannerism, their the way they explained, not just on visual, but in the body and the energy that came from that. That's where I saw a little more clues to me, to the type of person, you know, and what was going on. So, so just to understand that what we're looking at and how to place that so that we can start going down the right path, so that I don't get distracted and go down, say, looking at the wrong thing and then have to backtrack that and try to relearn something and hit it right. That was one of the biggest things that I found with the cases.
Here, I would like to add one thing, maybe, that
Yeah.
even if you know a person as a friend,
Yes.
as a relative, as a family member, our mind should not be prejudiced, right? Because we know a person. So, you know, our mind becomes prejudiced that a person will be a Vata, Pitta, because we have certain thoughts. I mean, when I was listening to you, that a Vata is, you know, in due course, I would like to change that perception that Kapha is good and Vata is not good. I mean, uh, that is not the case. Each
Right.
one has an equal importance. The world leaders are not Kapha, right?
No, I know. And the other thing I noticed is that most of the people, so far, I don't think I've run into anybody that doesn't have some Vata elevation that I could see. I know I'm so, you know, I in the beginning of this, but that's what I'm noticing, that there's a lot of, you can't miss if you're saying that there's some Vata increase that it needs to be mitigated in some way, unless I'm wrong about that, but that's one of the
So
things I'm noticing.
the key point here is we need to observe very closely before conclusion, before coming to conclusion. Isn't it, Anne? Do you agree with it? Okay.
Well, Dr. Priyanka, so 2 people of my 5, I was flip-flopped. And I was so shocked because I was like skinny Vata, heavy Kapha. And so because I
Right.
started,
A person can be Kapha and skinny as well, right?
I found
And a person can be obese and be a Vata, because obesity may be because of hormonal changes, water retention, not necessarily the fat accumulation. So if a person is obese, we can't conclude that person is Kapha. Please, we should never make that mistake. A person, an obese person can be a Vata person, can be a Pitta person, and because of wrong lifestyle, the obesity must have set in. So that is what we need to see. Okay, fine. Who will come next? Arma, you want to share? Arma? Yes.
It was very hard for me, you know, like watching you do your sessions with some of my clients, and especially the one that has the stent in her esophagus.
Right.
And because so what I noticed was, and plus I know her, she was not giving you all her information. And you saw when I tried to say something, she cut me off, and she told me before, this is my session. She didn't want me to speak, but then you asked me to speak and I tried to. And which was good that happened, because I got to have the experience of, you know, I'm sure you experience it all, you know. And I also, I did her pulse, and I had, but would you say that she was Vata Pitta or Pitta?
She was Pitta Vata. Pitta was more. And therefore she was, you know, strong-headed. She was like, no.
Yeah.
Right?
Yeah.
So that is one of the characteristic traits, you know, of Pitta people.
So, because I thought she was Pitta, But when I did her pulse, the week before, I did it 2 weeks in a row, and she was Vata Pitta. I don't know how to do anything but feel which one comes first and follows. And but she did have Pitta, Vata, and then barely, I could barely feel the Kapha. But knowing her circumstances, I would say she's mostly Pitta. And she took the test that you can take, and it said she was 60% Vata, and then the rest was mostly Pitta, maybe like 5-6% Kapha. And I totally disagreed with that. So between the different people, I felt like I wasn't doing a very good job myself with what I thought. Which I didn't share with them. You know, I kind of kept it to myself, but I struggled.
Now, it is the initial thing, and you know, Irma, I have done, like, apart from this education, we have been with your sister Julie and one more client. You know, we have done 3 and 4 sessions earlier to this education where you and I were doing. So we have been working for a long period of time. So it doesn't mean that we will be, you know, a good listener and a good observer in the first session itself. It takes time, so don't be hard on yourself. Just go again and again. See her pulse. If you have a possibility to meet every 15 days, see her pulse every 15 days. See her symptoms, analyze her symptoms, right? See what the changes are. If she's following a diet, for example, if she's not taking a herb, just one diet change you ask, not a, you know, the list which I gave you. One change, for
Yes.
example, ask her to give up wheat for at least 15 days. And this, you know, every one of you can follow in your practice. Suppose you, Kirti, like for example, you showed me your friend, right? Friend's daughter. Now, in that case, if you are close to her, go and see her pulse on day 1, right? Even if you don't understand where is Vata, where is Pitta, because when you come here and through our sessions virtually, we will be explaining you where to see Vata, Pitta, and Kapha. But you can go and just palpate, you know, keep the fingers like this, palpate. The index finger will show Vata, the middle finger Pitta, and the ring finger Kapha. So just go and see. And then after 15 days, give for 15 days, tell them, okay, just avoid, you know, just avoid some milk and milk products, or just avoid some wheat, right? For that.
Right. And she is doing a lot of those things
And then after
already because she
15
can
days,
hardly
again, you
eat.
go and check the pulse. And you will find out the difference between it, right? So that is how you learn pulse reading. You will not learn it, you know, and then after 3 months, 4 months, gradually you will start noticing the difference, right? Are you understanding?
One of the biggest takes that I got from this was or is the importance of listening, really listening, because especially working with people that we do know, because like I found myself feeling things that instead of just like being clear, like, no, Dr. Priyanka needs to know this. This is what I was thinking. I didn't say anything, but you know, I found myself thinking things. But when we listen and learn this, we probably don't have to even have that information if we're good listeners.
Yes.
Right.
Now, because you are discussing about this case of that female, which, because she had, now I will just, you know, elaborate the case which Irma presented to me, and how on the similar lines I treated a case on the similar lines what she showed. So she presented a case of a female who had severe GERD. GERD is gastroesophageal reflux disease, like it's a form of a hyperacidity, wherein the fluid from the stomach, if somebody are not acquainted with the terminology or they want to ask, please write in the chat box. I will explain it. So GRD is very, very common. In normal language, it is said hyperacidity. In medical terms, it is been said GERD, gastroesophageal reflux disease, right? You can Google it. Yes, perfect. Thank you, Andrea. So GERD, and in GERD, the symptoms are reflux. A person feels that there is a choking sensation in the throat, difficult to swallow, sometimes burning sensation, burping, excessive burping. The moment they eat food, they start burping, pain in abdomen, constipation, indigestion. These are the major symptoms. Not necessarily, you get all the symptoms in everyone, but few of the symptoms are there. Now, she had the case which she presented. She had this severe GRD blockage, difficult to swallow food, and she got a surgery done, a stent. She was, because there was a constrictor, stricture of the esophagus. Esophagus is a tube.
She had actually had that stretched 3 times, but it just didn't work. And so they
Right.
ended
It
up putting the
won't,
stent
it
in.
won't because it's just, it will constrict again because the root cause was not abolished. As you must have seen in many of my consultations, I always use the word root cause, ama, and that was creating the blockages. Now, this case, she's a lady. She presented in my clinic, and she had this severe acidity, like burning from throat till the stomach, severe burning for years and years, almost like 10 years. She was around 55 something, and she was complaining she could not eat any spicy, any nothing. She was having a bland food. When you say bland food, it was just salt and turmeric, not even coriander. Coriander is supposed to be the coolest. We, for pitta, the home remedies, cumin, coriander, and fennel. You must be aware of it. But she was able to just swallow bland food. Difficulty in swallowing, burning sensation, and pain in abdomen, right? She went and did an endoscopy. I hope you all must be aware what an endoscopy is. Anyone not aware of endoscopy? Daniel, are you aware what we do in an endoscopy?
Yes.
Yes, fine. So she had this,
Mhm.
when an endoscopy was done, there was a fungal infection in her esophageal, candidiasis, right? And severe ulcerations, severe like erosions, gastric erosions. And she was like miserable. She was not able to go out with friends. Even if she goes in gatherings, social gatherings and all, it was difficult for her because in India, we use spicy foodstuffs. Spices are a part of all our food. So we visit our families mostly on weekends or festivals. So social gatherings are necessary, and her social life was almost nil. She was not able to go out, nothing. So she was like, her doctor had suggested her to, go for some surgery or something, and she wasn't able to, she wasn't uh, fine with that because that was not giving 100% uh, chance. 100%, no one was giving her 100% thing that that surgery will be useful for her. So she visited our clinic, and we started with six we started with the 6 tools of Ayurveda. I will write down what are the 6 tools, and these 6 tools are something which we implement in most of the cases. Whatever come here, it was pertaining to the gastroesophageal thing, acidity, but these 6 tools are something which we generally use. First is the diet. Second is the herbs which we recommend. Third are home remedies. Fourth is the detox which we give. Yes, Andrea has done. Thank you. Panchkarma, diet, lifestyle changes, and Marma. Okay, good. Thank you, Andrea. Thank you. So, Panchakarma, diet, lifestyle change, herbal remedies, home remedies, and Marma. Perfect. So, these 6 tools we started on her because her case was severe. First, dietary changes. Now, in generally the Pitta Vata, she was a thin lady, and she had this vitiligo issue as well. Her case is there in YouTube. If you see Ayushakti Ayurved case, you would be able to see, it's a video with myself and her case of acidity. If ever you get a chance, you can see that case. Um, so she had this cases of skin condition vitiligo. She had this severe hyperacidity, and her weight loss because she wasn't able to eat. It was not able to digest. No, and rather cases of acidity. The case is of acidity, but she had an adjoining complaint of vitiligo. She came to me for her GRD. She did not come for vitiligo because that was chronic, and she did not want anything for that at that time. So so basically my point of saying that why she, because she was a pitta high, her proximity or her main constitution was more pitta, and secondary is vata, pitta and vata, right? So because she was high pitta, she is vulnerable for the high pitta diseases. What are the high pitta conditions? Acidity is one of the high pitta condition, and second pitta condition is the skin condition. So if a pitta person will take more of spicy foodstuffs or excessive salty foodstuffs, they are more prone or they are more vulnerable for pitta related diseases, right? Therefore, understanding the constitution is very, very essential. Why it is essential then? Because in a pitta person, if they get pitta disease, to treat that it becomes difficult. If a kapha person gets pitta condition, it is easy. If a vata person gets pitta condition, it is easy. But if a pitta person gets pitta condition, it's difficult to treat. It will take a long time. If a vata person gets a vata condition, if a person is high vata, the case which Mary have shared with me, she is high vata and she had osteoarthritis, and it was chronic for the past 10 years. She was dealing with that because she was high vata and she got a vata condition, so it will become difficult to a bit chronic. So therefore, we have to understand the constitution and which type of dosha is more prominent in that disease. In acidity, the pitta is more prominent, right? I hope you all are. Joseph, are you understanding?
Yeah.
Yes. If at any point you think that it's something then I will make it more easier. Fine. So here she was this pitta predominant, and she got a pitta based condition like of acidity, and vitiligo again is a skin condition where the pitta predominance is there. So I knew from that first point that she will require at least 1 year of medication, and that when you communicate, when you know in your mind that a person is pitta and she has got pitta, then you tell approximately how many months, how many years in such she will need. And you have seen in most of my consultations, I have told if it is a small, I have told you will require for 3 to 4 months. If it is big deeper, I told for 1 year, right? Isn't it, Kirti? Right? So that helps you to understand that you tell them that how many months you need the medication or you need the herbal remedies. Then the second I told her about the diet changes. The diet changes, as we will see also. In Pitta, 2 to 3 things we should tell them to avoid completely: sour and citrus. Even sour and citrus fruits for that matter, orange juice. We think it is nutritious, it's healthy because we are having fruits and all. But excessive orange juice, strawberry, or sweet lime for that matter, it will increase the acidic medium, it will increase the acidity. Then tell them to avoid gluten, because somewhere this acidity again was because of indigestion. She was not able to digest her food completely. The toxins were not eliminating out of the body completely. It was accumulating in a system, producing lot of heat, gases. It was reflux. The acid which is meant, the acid which is secreted in a normal quantity for the breakdown of food products, that was now secreting excessively. So in the food, these things you have to avoid: citrus, sour, fermented foodstuffs, even yogurt. Many people tell that yogurt, we need it for probiotic. Probiotic, we need yogurt. But right now, your major concern is the severe hyperacidity. Probiotics we can take care of later on, right? And if your gut health is good, probably you might not need it as well. So in that scenario, in that condition, it is very essential for you to guide that client that to avoid yogurt or any other sour, like there are other sour things also, ketchup and sauces, kombucha, isn't it? I mean, there's other practices which, yes, Joseph, you want to ask something?
Yeah, why fermented food is not good. I mean, I kind of understand sour and citrus kind of goes emotionally with the high pitta, meaning that the person is so angry and sour. So when you cut off the sour food and the citrus food, it can, and like I can understand that, but why the fermented food is not allowed? And is milk is okay in that case, and why also?
Yes, milk, again, milk has lactose in it. So in her case, because she had this candidiasis, and in her case, her agni or digestive fire is agni, right? The Sanskrit word for digestive fire is agni. Her digestive fire was very, very weak. She was not able to digest any gluten. She was not able to digest any lactose. And whatever she was eating, even if, like milk or yogurt or, cheese for that matter, was getting converted into ama or toxin. Ama is a toxin, half digested food. So in her case, in severe acidity and GRD, we strictly avoid milk and milk products. The next question about fermentation again is fermented foodstuffs. They increases vata, air component, as well as pitta, because they have been kept outside for a longer time, right? Like fermented, how you must be aware of the fermentation process. So those fermentation process, when you consume them, they increase gases or pitta. It makes the body more acidic, and in such condition, we don't want the body to be acidic because it will aggravate the gastritis. It will cause more acid formation and the erosions in the internal lining of the stomach, right? So therefore fermented foodstuffs, because it creates more acidic medium, should be avoided.
So can I ask one thing? For the milk, is it okay for vata and kapha cases or no?
Now you need to see if a vata person has a osteoarthritic, severe osteoporosis, and there is no ama in him or her. Only vata means only degenerative condition. So then we have to nourish. We don't have to remove the blocks because ama will create block, right? So if you are 100% sure that a person doesn't have ama, then you can ask them to have milk.
How do
Then
you
the
know if
only
it's 100?
sorry.
How do you know if it's 100% sure that they don't have ama?
So you will have to ask few symptoms. You'll have to ask few questions about the digestion. In your uncle's case, I asked, and I asked about his digestion. Then there was congestion in the sinuses. That are all symptoms that the food is not completely digested, and it is all converted into ama or the toxins. So by proper case, now when you learn the pulse, through pulse you will know. When you do the face, when you understand the face reading, by seeing the face also, we come to know whether people have ama or not. But till that time, till you achieve that perfection, you can question them about their digestion, about their sluggishness, whether they feel heavy in the body. If a person is full of ama, they feel heavy in the body, they feel sluggish, they feel lethargic, right? So these are the two, three. There are other symptoms also, and disease wise, the ama manifestation is different. So when we are seeing disease, now in her case, she had ama, this patient which I am talking about, that was giving her mucus or sticky consistency to the stool, right? So she used to go 2 to 3 times a day, but still there was not a complete evacuation because there was stickiness in her stool. Her appetite, she was not never feeling hungry. The proper hunger, like, yes, now it's a breakfast time, I'm hungry, I need to eat, that hunger sensation was nil for her. She was just eating because it was breakfast time. Are you, I know you must be, many of you have come across such people who are okay even if they do not have their breakfast. By 2 or 3 p.m. they feel hungry. That is a symptom of great ama accumulation at times. Yes, Arma, you want to ask something?
Yeah, so my client, she has just a little bit of yogurt and tomato soup. Like, basically, this is what she's living off. And both of those, I'm telling her that's irritating. And because this has made her very angry, like she never snaps, and she does all the time now because of this imbalance. But I keep trying to get her, she tries to get dairy free, but it's, so what do you do when she's like, I have to have, and you could see how thin she was. She's lost so much weight. She eats like barely.
In this case,
So what?
In this case, as I told you, if in this pitta condition and your case, which we are discussing, and similar I'm discussing, if a person has excessive acidity or GERD, strictly no tomatoes, no sour, no citrus, because that will create more acidic medium, no yogurt and no milk. So the only
And
thing is that if you don't know anything, just ask them to be on a moong and a vegetable diet for 3 to 4 days minimum. Because when you are asking them, if forget about the herbs, forget about the other home remedies and everything, just ask them to be on moong and vegetable diet, moong soup and because that is um, easily digestible, that doesn't produce ama, and can, because it is a good source of protein, they don't feel weak, and that will help in ama pachan, in digesting that ama, in flushing that ama. So in fever like condition, in COVID, most of the people, like, they were eating chicken and stuff like that. Oh, we will get energy and we will not do that. Is a wrong perception. During COVID, your Agni is affected. There is a lot of ama. The virus attacks your pancreas, virus attacks your liver. You should have a light diet. And trust me, I followed this on myself. I did not take an antibiotic. I have got, I don't know, I've never got tested, but I had symptoms. I was only on moong and vegetable diet for 5 to 6 days and no symptoms at all. So, so that is how the ama should be broken down. If you don't know anything, just diet. Moong vegetable diet with certain spices, which we advise, ajwain and all those things, right? Because that helps in aam pachan. Black pepper, turmeric, dry ginger powder. Those are good herbs which are easily available at home. You can just advise them to keep these few spices in everyone's home, or gift them a dry ginger powder, black pepper powder. These small things, even if you are at home, that will help you to get rid of these conditions. So in in her condition, I put it on a strict diet. I started the herbs which we generally use for GERD for almost 12 months. Gradually, after she was feeling better after 3 4 months, and then I started tapering down the doses. I gave her 6 tablets initially. I made it 4, then 2, likewise. And then we repeated her endoscopy after 6 to 8 months, and her candida infection, that fungal infection which was present at in her esophagus, that was gone. She was able to eat normal food. She was able to travel, which was a good victory for her, right? Her, a person wants some aim, like Dr. Naram asked, what do you want in your life? So she wanted to be with her friends, she wanted to travel, she wanted a good social life. She was not worried about any fungal, any gastric erosions, or some allopathic doctor told her she might get cancer or polyp. She wasn't worried about that. Her main worry when she came to me, that I want to meet my friends and family members. And after 8 months of our treatment in GRD acidity, she was okay. She was going to picnic, enjoying, eating everything. Now she eats everything. She comes in some festivals like Diwali and all. She meet me. Yeah, I'm doing good. She takes 1 or 2 Ayurveda and Pitta Shamak, 1 or 2 tablets, and she's fine. So that is what. And in this post COVID, because of sedentary lifestyle, gastric issues are very very common. We are not exercising, we are eating late, we are skipping meals. In such things, we have to be very careful about our gut health. Otherwise it leads to conditions like GRD, acidity, IBS, constipation. Now, I had a more complicated case again, like severe polyps in the intestine, cancerous polyps. So that we will discuss later on. Today, I will just focus on the normal cases which you all must be seeing in day-to-day practice or with the normal clients. And then in due course, we will discuss about this also. That how a lady, she was 38, 39 only, and she was having 40 to 50 polyps in her intestine. She was advised to go for entire removal of colon, but because of her herbs, her colon is saved now. Yes, Andrea, you want to ask something?
Yes, is it safe for me to assume that everyone has of different degrees, because there's also environmental toxins we're each exposed to?
If you have a good lifestyle, if you exercise, if you meditate, then the ama is very minimal. It won't disturb or it won't give you any ailments. Mild 10%, 20% ama may be there, but then it becomes dangerous when it manifests into any disease, right? So we
Okay.
might have, but it doesn't give us any, till the point it doesn't give us, and we know how to balance it. It doesn't mean that we don't eat out or we don't eat stuff which we this thing, but you should know how to balance, how to digest that ama.
Okay, and I have another question. Is it normal for the stomach to growl an hour after eating?
No. No. It is a sign of avata, gases, and somewhere the bowel movements are not clear. So when the bowel movements are not clear, the gases are trapped in the intestine and they start growling. Yes,
Can I ask a
Kirti.
question about that?
Yeah,
So
yeah.
are you talking about just the stomach noises, or are you talking about actually being hungry?
Well, it's me, actually. I could have eaten something and an hour later, my stomach is growling and it feels empty, as if I need to eat again.
So you
I mean,
feel
I do have
hungry.
issues. not very hungry. I think I'm just cravenous, could be just me, I've trained myself to just want to pack it in all the time. But my stomach growls an hour after eating something, and I find that very unusual.
We will discuss your case and how we can help on it. But yes, we need to work on your Agni. This is something, where the Agni issues are there. Uh, Agni is still needed to be taught in your sessions. Agni is the digestive fire. You can just write down Agni, Agni, which is digestive fire. So this Agni should be functioning well, right? Then there are 4 different types of deranged Agni. So this is one of the type which you will learn in due course. So we will discuss it. Yes, Kirti.
Yeah, as you said, that if you have sinus pressure or something like that, then you have in your body. So that means I have toxins in my body, or yeah.
Your was post-COVID. You already did a detox. So your was post-COVID, which you had. And I told you to get a steam inhalation, which you not. So, but yes, when there is a viral illness, whenever you attacked by a virus, be it COVID or any other virus for that matter, a normal virus also, the Agni is less, the digestive fire is less. So we should be focusing on our diet, eat healthy. And when we met Kirti, I will tell everybody, she was having a COVID infection that time, but the symptoms were not that profound because she was on the detox diet. The only thing she had this all the things, nothing related to her lungs. Her lungs were clear, but just the toxins was in the sinuses, and you just need to do the steam inhalation.
So I have one more question. I have some pain in my neck. So is it because of the sinus, or is it stressed out, or is there anything else?
You want to discuss here now?
Yeah.
Okay, so your the pain was because of your stress, definitely, and a high vata which you are going through now, right now. Some other conditions as well. Yes, Anne. Yes.
So I noticed, I was a little bit surprised when, okay, you know how we like did our person and then a little bit later you sent us an email? And then I was like, they only had a couple of herbs. I'm like, I have lots of herbs. If you only got a couple and someone else has a lot, does it mean someone more sick than the other? Or like, I just was surprised that they only got a little bit of herbs, and I was expecting this big long list and some resistance from them from the big list, So I wondered, did you do that on purpose, like to get them slowly into it, or is it some indication of how sick you are or not, or anything?
No. Is Arma there? Yeah. So yes, I see. If suppose 2 herbs are fine with it, I'll give 2 herbs. But then there are certain issue which needs to be addressed simultaneously. So like Kirti and Arma might have got a good list and they must not be happy with me, but then they need it, and you are happy with me because I gave you 2 herbs. But I gave 2 herbs to your grandchildren, but that was enough for them. So you have to see.
I thought Rachel would have this huge long list, but
Rachel's condition is different. Rachel's condition is more of emotional, then we need to work through marma and other things, and 2 herbs will be definitely helpful.
Thank you.
And again, she is a pitta, and you have to be very careful when you are giving a pitta person. If she is confident, and she will take all the herbs. So when I give the herbs, I see the person's prakriti also, constitution, that how sincere they will be in taking the herbs. If they are vata, very difficult for them to take the herbs even for a month or 2.
It's true. I was bad and skipping always. I can get 2, but never 3, and vata. So amazing.
Then if a person has a bit of kapha and pitta people are obedient. pitta patient. But if a person is vata, then you have to give them their time.
Thank you.
Okay, Jena, you had question. No, you don't have you have a question?
I don't have a question. I wanted to, you said something. I'm just trying to piece it together. You said you have to look at the prakriti to make sure, to see how they take the pills. And you said the vata person doesn't remember to take the pills. The pitta
No, they
person is
don't remember. Their minds are changing. At one moment, they will say, "Oh, I will take from tomorrow," and they will get up in the morning and they will follow everything which I have said. Even if I give them 10 pills, they will take it because they are programmed like that, right? They will do that. They will do it for 2-3 days, and then they will say, "Dr. Priyanka, she's just giving me so many pills, it's not helping," and they will close it, keep it in a shelf and forget about it. Then after 1 or 2 months, they will mail me, "Dr. Priyanka, I consulted you and I am not getting results." Then I will write an email, "Are you following the diet? Are you taking the pills twice which I have recommended you?" Right? So that happens. On the other hand, pitta person is, they will ask me 100 questions before starting. When I give them recommendations, they will give me 5 emails in the next 2-3 days. What is this for? They will understand each and everything. What are the ingredients? What are this? What are that? And then, they will stick to it, to the core, till they get results. So, I'm happy with those. They ask me questions. They are, fine.
Well, I noticed that. I so appreciate you giving this explanation, because in the consultations, what I noticed is that, you approached it differently than some of the others that I've seen. And so you must have been able to see this person is more pitta and needs more of an explanation about what the herbs are doing and about how the protocol fits into their life, which was, I noticed that I was like, wow, she's giving them so much information that is very beneficial. I really appreciated that. I mean, I just noticed the way that you were working with them differently. So, but what about a kapha person? What does a kapha person do?
Kapha person will delay his or her consultation. Right? They will not, schedule the consultation. But once they are, sure they have to do it, then, they will do it nicely. They are a bit lazy and lethargic. But once a thing comes into mind, once they understand that, they need to do it slowly and gradually with little push, if their partner or their family members are pitta, then they are, then they can sail through. They need a good people surrounding them, kapha. The percentage of kapha people is very less, thankfully. You won't see many pure kapha people, never. Pure kapha people are 20%, but they are, they are needed. Most are vata and pitta.
So Dr. Naram was kapha. What percentage of, was he kapha pitta or vata? He was pitta?
Maybe
Kapha
he was
pitta.
a sama prakriti, some dosh, everything in proportion. An individual like him was born in a century, right? So there is one concept in when all the doshas are equivalent, vata, pitta, and kapha. This is sama prakriti, which we say. So it doesn't matter which you have trained your mind through that the external factors don't influence your mindset or something. So he had gained that. He had that supreme power. I think he was samprakriti. All the three doshas in equilibrium.
Wow.
So when you look at a person and they're talking to you and they're giving you, their symptoms, and they're giving it to you in a specific way, and maybe in one way they're like, oh yeah, whatever, they're very vata, and then in something else they're like, no, but I do this and this and this and this, and they're very pitta. So are you noticing the areas that they're explaining so that you're tying it together? Is that what you're doing?
Yes, so we need a deep evaluation. We need to, understand the words and simultaneously see the features. And in 30 minutes, yes. So in 30 minutes, it is difficult to understand a person, but gradually when you do a more follow-up and stuff like that, then you become more perfect. But yes, we need to be very careful when we are analyzing. We need to be very, very careful. We should not miss a point, very attentive at that time. So we also should be very attentive.
Dr. Priyanka, when we take a pulse, so even my own pulse, so I was taking it and then it felt like I felt vata, and then I felt a little bit strong. And so then I was being a little more careful, raisin water, being a little more careful what I was eating. And then when I felt it, I felt vata, pitta, and then I could feel a little kapha also. And are we striving to be able to feel all three kind of equally? Is that our goal? Is that
you are not supposed to check your own pulse. Even if you are a great pulse reader, never ever check your own pulse.
Oh,
Never. You can check others' pulse, but you should not check your own pulse.
oh my. And then so say I'm feeling that. I go with that. I'm feeling a little bit pitta and then alter, but don't confirm it with my own pulse.
Yes. Okay.
I
Any
mean, are we
questions?
even
Amisha,
Yeah.
you have any questions? I hope you are listening and
I am listening.
Yeah.
I'm so behind because I couldn't get access
no
and I
worries,
was busy with schedule.
but I hope you're
But-
understanding, right?
No, I'm listening and I'm slowly going through all the videos and the questions and stuff. So I'll be on track soon. Okay.
Very good, very good.
Thank
very
you.
good. Okay.
I-
So fine. Shall I move to other cases, or this GRD acidity related somewhat concepts are clear somewhat? It will take time to understand more. Yes, Joseph, you want to ask something?
Yeah, I have a couple of questions. I really wanted, I know that there was a slide or a couple of slides during the lectures, but if there is some kind of a chart where you can have a correlation between what type of diseases and what type of doshas that correlate with what type of doshas,
So the
that
next
would be very helpful.
the next session will be there with detailed, description of the prakruti and doshas, everything. What you
Yeah.
they in the next chapter it's there. Yes,
Okay.
Mary, yes. yes.
Is that myself? Yes. Basically, my question is, when you're looking at someone, it seems to be the underlying thing, the best thing to know is to be able to determine the prakruti, so then you'll know which way you're going to go. Do you notice that? How am I going to ask this? From the way someone's speaking to you, or what is it that you first look at to be able to determine that, so that you can consider what would be the best thing for them to deal with? Because as opposed to like a vata person might take a long time for a vata condition, or like you were saying, or pitta person. How would we know? What's the best way to determine the prakruti of someone?
So you want to ask that how to determine one prakruti? That is the question, right?
Yes, when you're seeing somebody, especially if you don't know the person, and it's just objectively, and you're trying to hone in on that.
Yes, so that is what when we see a person, first we need to, you will learn this in the next, the next chapter is all about the prakruti, but you have to see the appearance, right? Then in the next chapter, when you will be there, they will tell you the kapha will have this type of hair, this type of face structure. Pitta will have this type of face structure, the skin tone. It's not the color. So you will learn that.
Okay.
You will learn that. And then we can talk more in deep, because right now, if I say, you will not find any correlation till you have any theoretical things with you. So the next chapter, which I think on the next Saturday, it is all about.
Okay.
Fine.
Okay, thank you. Yeah, it's coming. Thank you.
Dr.
Yes, I will
Priyanka,
medicine. Yes, yes, it reads.
in reading the face, do you also read the eyes?
Yes.
Okay.
Yes, yes, it's there. It's a part of Prakruti Parikshan.
Well, that concerned me because when we met with my client Grace, the lighting was so poor, I was worried that you could even make out that it was a woman you were talking to. You know what I'm saying? And I don't even know how you were even able to. I kept trying to tell her, please give her some more light, but she was so focused on you, she didn't see my messages in the phone at the time. And I was so worried that she would, you might miss something, but she's, you know.
But her conditions were more different at that time. So we focused on her condition. She had a specific condition. Like, it was not just a normal consultation. The case which she had a proper, I will tell, I want to share this Grace, right? Grace.
Yes, she has the
Kidney
kidney stones in both kidneys, and she has stents put in, right? And they've been in 4 months now. And so I brought her to you because she wants to know if the herbs could dissolve the, kidney stones before going to the doctor to have them broken up.
So yes, now I recommended her herbs, and I'm sure because she had a 7 mm or 8 mm stone, which were tiny according to me. And now because we are discussing kidney stones, let me tell you one case about this renal calculi. Now, renal calculi is something, which allopathic science doesn't really have an answer, right? If the stone is more, they advise for surgery, or otherwise they have this lithotripsy. I hope you must be aware what is, like, they break down the stones. You are aware of lithotripsy, everyone, right? It's a Daniel. Are you
Yes.
aware of lithotripsy?
No.
You are aware of it, right? You are understanding, Daniel, or if you have any questions, please do ask.
So is it like a laser? So they
Yeah.
go.
I have no questions.
Okay. Yes, it's a like a laser thing where they, Andrea, must you were telling that time, no? You want to elaborate?
Yes, so they plan on breaking up the stones with the laser, right? But she would rather go this route with Dr. Priyanka. So she's going to delay that surgery, So anyway, she ordered the herbs and she's happily taking them because I think she's a kapha. And so we're watching to see. She says she's not experiencing much pain as before, and so, well, we'll see. So my question is this: how long would she have to take these herbs before they're broken up? Because we didn't get that information.
Yes. So no, I told her, recommended her to take for at least 3 to 4 months. The problem with the renal stone or renal calculi is that even if you get it done or get it broken by a lithotripsy or something, the root cause is that they should not recur again. You must have seen those people who have a renal calculi thing. They have this recurrence, repeated recurrence. Even if it is removed, again it comes, again it comes. So here we have to address the core issue that this stone formation is not again and again, right? So we work on that. Now, how is this stone formed? Stones are maybe urate crystals or oxalate crystals. Basically, those are waste products, toxic substances, which need to be flushed out of the body. But somehow they are not getting flushed out. They accumulate in your system. In some case, it may accumulate in the kidney. In some cases, in the bladder. Now, if it is the stones are there in the ureter, ureter is a tube which connects the kidney to the bladder. And the ureter is a thin tube. The width is very small.
And that's where it is. And that's why
Yes.
it's causing her such tremendous pain.
Yes, yes.
So is that where she
So-
had the stent? Was in that in that tube? And then does the stent, does she still have pain when there's the stent been put in? Or does the
Yes, she has,
stone?
the stents are still there, and that's the next question I want to ask. How long can the stents remain in there if she's going to do the herbal route of allowing the herbs to dissolve this waste?
Now, as I said, that if there's in a ureter, the width is very small, the width is very narrow. And these crystals or these toxins are gradually accumulating in the lumen, right? Suppose if this is a ureter, it is accumulating in the lumen, it forms a blockage, right? Because there is all deposition of this waste products, not necessarily that it may convert it into stones, right? It may lead to sludge formation, sludge like a toxin, either in the bladder or in the ureter. So when the sludge is more there in the ureter, the flow of urine is obstructed, and then the urine moves behind, backflow, giving rise to swelling in the kidneys. And therefore, her report was showing mild hydronephrosis, right? Because the urine was not completely getting down because of the sludge or the deposition of the toxins here, right? And it was backflowing and creating swelling in the kidney. Now, the stent was, it's a temporary thing, temporary, you can say temporary solution, because you put a stent, you widen that lumen which is constricted so that urine flows. But the toxin formation is there, toxin is being formed, and this toxin is being accumulated continuously. So unless and until you don't work on the root cause of the toxin being not formed, you are not treating renal stone.
Right.
So my question is then, as she takes these herbs, I guess we recommend she does the daily detox of ghee in water with cardamom,
Yes.
right?
I
Is it
have told her to take ghee before and after meals also. Right?
with each time with cardamom, or just first thing in the morning with
First thing in the
cardamom?
morning. First thing in the morning. Because in stone formation, when you form a stone, two doshas are involved. Vata and Pitta. If it is, there are different type of stones. Some stones are Pitta, which we will study later. Some urate crystals, oxalate crystals. So depending on the dosha can be different. In some cases, it can be Kapha Vata stone. In some, it can be Pitta Vata. But Vata is very important in stone formation, right? And the Apan Vayu, I hope you all are aware of Apan Vayu now, because your Vayu chapter is over. You are all aware of Apan Vayu.
Yes, Apana.
Yes, Jamie,
Yes,
are you aware of Apan Vayu? Yes. Which areas the Apan Vayu governs, Jamie?
Hello, can you hear me?
Yes. You need to unmute. You need to unmute.
Okay, unmute now.
Yes.
Apana Vayu is it's Vata, air flow, nervous system.
It governs which area? Which area is the predominance of Apan Vayu? Like our body? The different
Like nervous system, head? No?
No. Joseph?
I think the intestine, the digestive system kind of, or the brain,
No.
or something.
Every one of you need to revise. Andrea, where is the Apan Vayu?
this is how I remember it. I always say below the navel.
Perfect. Perfect. Below the navel, in the pelvic area, right? Apan Vayu is in the pelvic area, right? Apan, it governs your bowel movements like the stools, urine, right? In females, the menstrual cycle, right? So even the birth, the delivery of child is all governed by the apan vayu. So if the apan vayu is imbalanced, then your urine formation or urine elimination is affected, right? Or you have constipation. In females, if you have dysmenorrhea or amenorrhea, then the vata or the apan vayu is affected. So every one of you, please, 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 5 subtypes of vayu, 5 subtypes of pitta, and 5 subtypes of kapha. We need to know before we start understanding about disease. Go through the notes, see which are the primary, which are the 5 vata, 5 pitta, and 5 kapha. See their areas, right? I want every one of you, Jamie, I want you to go through it and write an email me then. In short, one word, right? Joseph, you also, you will have to read and then send me an email of where are all these 5 vata, 5 pitta, and 5 kapha located. Because that is very, otherwise we will not understand that how disease formation is there.
Can you say it again? Can you say the question again?
Yes, I want every one of you to go through our first lecture on doshas, which we did. There were 5 types of vata, right, Daniel? You heard that lecture, 5 types of vata, 5 types
Okay.
of pitta. Andrea, can you tell the 5 types of vata, 5 types of pitta, and 5 types of kapha for them?
Yeah, the 5 types of vata is prana, udana, now I'm nervous because, okay, it's prana, udana, samana, apana, and vyana. That's the
Perfect.
5 types of,
Very good. You should clap for her. Good, very good.
thank you.
Anyone, Mary, would you like to tell 5 types of pitta? 5 types of pitta.
Oh, I don't have it. Wait a minute.
Okay.
I can't do that right now.
Is
I'm
there a way we
confused.
can translate it into English?
This
I feel
Yeah,
like I'm
yeah,
learning,
yeah,
like I
yeah.
have to
cannot be
learn Indian.
translated.
Oh, I'll be ready next time. I can't do it. Wow.
This
I
is
don't want to say
Anisha.
the
I can
wrong thing.
try.
Yes, Amita.
Please.
Yeah. Yes, please. Please go ahead. Yeah.
Okay. Alochaka, uh, Sadhaka,
Right.
Sadhaka
Sadhak,
Pitta,
right. Yes.
Ranjana,
Ranjak, yes.
Vajraka,
Pachak,
and Panchanka.
Pachak Pit. Yeah. And
Oh, Pachaka, yeah, sorry. There's no N. Yeah.
one more. Bhrajak.
I said,
Bhrajak Pitta.
oh,
Bhrajak
Brajak.
Pitta is
Okay.
on the skin. It
Yes.
gives us the skin. Right?
Yes.
Everyone, I don't think so. You need
No, we need to learn this again over and over
yes,
again.
you
Yeah.
need to
But
learn
we
this.
have, I think we have to learn it in English too. Like we have to have some kind of like correlation into English, because it's like, yeah, I mean, I got the whole vata, pitta, kapha, and I like, but there's so many Indian words. I feel like I have to get an Indian class or
Right,
something.
you are right. So, let us make something simpler. You're right about it. If you correlate some English word, then it will be easier for you to remember. I understand. Okay. And kapha also. So someone want to say about kapha? Anyone? Kirti, you want to try 5 types of kapha?
श्लेषा का कफा,
Hmm.
अवलंबा का कफा,
Hmm.
then बोधा का कफा,
Hmm.
then क्लेदा का कफा,
Right.
the other one, tarpa का कफा.
Right. Very good. Very good. Now, homework for everyone.
Okay.
Because I want you to be familiar with these words, and in meantime I will do something about giving the English thing. But please write all this in an email and /- their important place where they are, right? Like Bhrajak Pitta on skin, Ranjak Pitta liver, it is there. Go through your notes again and again till you find that one specific place where it governs. Okay? Fine. I hope you are all okay with this thing which I gave it to you. Jena, fine. You want to do it, right? Okay, okay, fine.
I have a question, Dr. Priyanka.
Yes.
So let's say I just think of a person. Let's say I say either Sarah or Rachel. And then I'm trying to say, am I going to find one subtype, either Vata, Pitta, or Kapha for her, or might I find a couple of things?
No, no, no. These 5 subtypes are there in every individual, in each one of us, right? All 5 types of Vata, all 5 types of Pitta, and all 5 types of Kapha are there in each one of us. And collectively, they are functioning. For example, in a government, there is a prime minister, right? But then there is a defense minister who takes care of the defense. There is a finance minister who takes care of the finance, right? So Vata has assigned 5 ministers, right? One minister, like Prana is taking my territory, is only to take care of this thing. Okay, I will just take care of respiration. Udana says, I will take care only of speech. So you cannot, in an individual, all these are functioning well. In disease condition, this vata goes haywire. One minister is doing going and doing another minister's work, going into another territory, and then there is a battle between the two. That is what a disease is, right? So then when you have to correct the disease, you have to bring them to their original place, tell them to do their own work. That is what a vaidya or a doctor should do, right? Understand?
Yes. So then there should only be, for that person, one subtype.
Every person has
I mean,
everyone.
in a diseased person, they would have one
No,
sub.
they will have all these subtypes. A
Okay.
diseased person also will have all these subtypes. They will also have 5 vata, 5 subtypes of vata, 5 subtypes of pitta, and 5 subtypes of kapha. It's just their territory changes, their action changes. Stop doing their work and they start doing someone else's work, right? So when we focus on one disease, which we will be doing in our course, we will discuss that. Okay, it's not that difficult, I hope. First, we should know what that 5 types of vata, pitta, and kapha. So that is prerequisite, right? So please go through it. Now we were discussing kidney stones. So in kidney stones, the origin is again ama, or the toxins being formed which are not flushed out completely. They stay in your bladder or they stay in your kidneys. And because of the action of vata, vata has a dry action. Vata is dry in nature. Because of the dryness of the vata, they start forming stones, right? And then these stones, they can either lodge in kidney or ureter or bladder. In wherever they lodge, they will show different symptoms. Pain will be there. In some people, the pain is there localized in the loin area. Loin, some have loin to groin, right? So this case which I was, she presented with a severe pain. She had multiple stones ranging from 5 mm to 12 mm. The largest was of 12 mm. Somewhere in ureter, somewhere in kidneys, in bladder also. So when it is in the bladder, the urine is burning sensation, sometimes red color urine. The urine is, they do not pass urine completely, and then they have more chances of urinary tract infection. Because if the urine is there lodged in the bladder for a long time, they will start producing microorganisms, bacteria. And gradually, if we do not take care of this urinary tract infection, gradually the infection moves towards the kidneys, giving rise to more severe condition. So here the primary aim through the herbs, which I advised Rachel, is to flush the toxins, to break down the stones, also to work on the metabolism so that there is no more ama formation. Give them the diet in kidney stones, the diet should be that those food or those fruits or those vegetables which have seeds within, seeds like tomatoes, lentils, lentils. Yes, Jena, you want to?
So I'm sorry, I missed that. So you're saying to make sure that they don't eat foods
Yes.
with seeds? Okay, thank
They
you. I missed
don't
that.
eat those vegetables or fruits which have seeds in it. For example, tomatoes, brinjal, eggplant, eggplant. That is, in India we say brinjal. It's eggplant there.
But
Then
what if they squeeze out the tomato seeds? Is that okay? Or is that nightshades? No nightshades?
yes, better to avoid. Then even high protein diet like spinach and excessive lentils or beans, kidney beans, black beans,
So not to have those.
not to have them.
Okay.
Because this high protein is difficult to digest. They produce lot of toxins, right? And then these toxins will accumulate and
Now,
give rise to further stone formation.
now, one of the things you told Grace is to not to consume a lot of mung soup because it's high protein.
Right.
And that surprised me quite a bit. Not the high protein part, but that she couldn't benefit from this great food as much as she would like to. I think you told her she could only consume it one bowl a day, I think.
Yes.
Okay, yeah.
Because you have to be careful. If we put her on the detox diet, if you have seen the healthy me detox diet, it has mung bean all the 3 meals. So we need to be very careful in patients of renal calculi for that matter, or creatinine. And in many of my clients, when I'm consulting, I ask them about any kidney condition, whether they have any chronic kidney failure and all. In those cases, either I don't advise them detox, or if I'm advising, it's only 1 meal of mung and others are vegetables.
So does it?
with my, go ahead,
Oh,
Jana.
sorry, Java. I was just wondering
No.
the difference. Are you specifically saying the green mung dal or the green mung, or can she have yellow mung
She
dal, or
can
it's
have in
completely?
moderation. She can have in moderation.
Thank you.
Not excessively. In a normal, like when we are doing the detox, when you did a detox, if you remember, you were having mung bean soup for the first 5 days in the breakfast, lunch, and dinner. For them, though it is easy to digest, still we need to be careful because we cannot give them only protein diet. Then it will lead to some or the other kidney stones. So we need to be very careful with them. Only 1 meal a day, and that too mung beans because it is easy to digest as compared to other lentils.
So in that situation, do they give them vegetables? I am so sorry, Joseph.
Me. Oh, wait, sorry. Go ahead. Go ahead. It's me. Go, Jana.
No, I was interrupting. I was just barging my pitta. So in that case, do they only eat vegetable soup? If you're on that detox, something very, very easy to digest?
So then you have to make their meals, formulate a different meal plan for them, right? One time, especially the daytime, a mung bean soup, then vegetable, and then add some carbs also for them, maybe a rice porridge or something like that. Seeing other conditions as well, right? They should not be a diabetic and stuff like that. So taking into consideration everything, you should formulate a new diet program for them. Yes, Joseph.
With my aunt, she had a history of having kidney stones, and you told her like you give her a certain diet till she loses like 4 or 5 pounds. I wonder if all of that stuff applies to her as well, all the kidney stuff.
Did you give me history of her kidney stones? No.
Yeah, she had. She had like had stones. I think it was gallbladder.
Gallbladder stone is different. Gallbladder is pitta stones. Pitta stones. Different than this. Different than this. there only pitta and vata are involved, right? So then the diet becomes different. For them, mung bean is okay. Mung beans are okay, but they will have to avoid excessive spicy, salty, and stuff like that.
So
I
let me
missed
ask
the
you,
We are
first.
discussing renal right now, but yes, in gallbladder, the diet will be a bit different.
It's gonna be different.
A bit different, yeah.
would drinking distilled water help with any of this, or
Drinking normal water,
distilled?
even if you drink normal water or distilled water, because the idea with distilled water is more alkalinity, I guess, right? Alkalinity.
A little bit.
I think if they have this tendency to form renal stones, their water intake is very less comparatively. So the first advice you need to do is ask them to drink ample amount of water. Second, I've seen in my clinical practice that most people who have this renal stone, they have a tendency to hold their urine. Like when they get this sensation of urine, they tend to hold it for a long time. They don't go it immediately. This is an important concept which we will be covering in our lectures, that this vague or this some urges, natural urges, should not be hold for long. And urine urge or fecal urge, or for that matter sneezing and all, we will learn. You must have learned it in the 100-day course as well.
Yes. So my question is, how long can she keep the stents in?
Once her urine outflow is better, she did a uroflow
Yes.
yes, so we can repeat it after 4 months. If the things are better, probably her urologist can give a call to remove it off.
Okay, because she's already had them in 4 months. And so
We will let her complete this herb course, and then we will,
got it. Good. I just
or
want to make sure she could keep them in. Okay, fantastic. She's
okay.
very happy with her herbs. She's dancing now and singing, so I'm happy that she's feeling better.
Right. So
Dr.
we will,
Priyanka, I have
yeah,
one question.
yes.
So many of my stoned clients, I get them, they don't come to me because they have a stone. They come to me because when they try to get the stone out, they injure them and they become incontinent and scar tissue and many complications like that. And then so my patients ask me to apply what I know about scar tissue to these areas. It's a little uncomfortable. Many people don't do it, but I do for them. But I'm wondering, do the kidney stone, then when they become incontinent now because of the medical procedure, do we apply these same principles of the kidney stone to them? Does that complicate things, and we attend the kidney stone first, then the incontinence second, or does it go in together? Because it kind of came not necessarily together, because it's kind of trauma-ish related, the incontinence. But anyway, what do you say with that?
So if their urine stones are already addressed, they do not have any urine stones currently, it's just the scar tissues or the damaged thing, we need to work it on a different concept. Then it is just rejuvenation of the damaged tissues, right? And more vata condition, because of excessive, when it is a scar tissue, it means the predominance of vata is there, and then we need to treat it different, right? And then in such people, even after they do various procedures and there are damages to their kidneys like cortical scarring and stuff like that, they still in future they will again have these renal stone issues. So in that, then your approach should be do both heal the damaged part, and also ensure that there is no further formation of the stones. Right. So if you are all bored, we can wrap up this, or you want to take one more case. I mean, it's if you are tired and bored, then we can stop. Otherwise, one more case we can discuss.
We can take more, but I really wanted, I'm not getting the concept of the kidney stone like too much. I don't know, maybe it's something that I'm not grasping the concept like fully. So if there's an article or something that I can read about it, or so, that would be great.
Fine. I will
Like
share
how,
with
like
you. I will share something with you. Right?
the
I
whole
will
like
share.
pathology, yeah. And I have a question that I really wanted to ask beforehand. Like, is there anything with Ayurvedic medicine? I mean, I have my cousin, he smokes cigarettes, and I like, is there anything in Ayurvedic medicine that addresses addictions, like smoking cigarettes or alcohol or whatever it is for that matter? But I'm talking about specifically in this case,
I
smoking.
have seen people with addiction, smoking, drugs, anything. They have very low sadhak pith, willpower, or some how you say, some previous trauma, emotional blocks or something which cause their sadhak pitta to. Therefore, I told you, I want you to be very well versed with these 5 subtypes, because when I will be talking, I will be detailing you in details. I will be giving you details of each condition. So I will frequently use these terminologies of sadhak pitta, bodhak kapha, whatever. So this sadhak pitta is the main location is in the heart, right? The heart. So because of previous trauma, emotional blockages and low willpower, they turn to these things. They turn to addictions, right? Now, if you want to get rid of this addiction, you have to increase their sadhak pitta, remove their blocks. So we do give them herbs. We advise them panchakarma and detox procedure, right? But simultaneously, they also need to work upon, they also should have the desire to get rid of it. So we do work on this. We have this, I had this young boy, 20 years, and he was taking some weed or some drug for that matter. And his parents were very much concerned. And we started with our herbs like brain toe and mind power, bliss, meta boost, heart tone in high doses. We did panchkarma, detox. We gave him heart dhara, shirodhara. And after an year, he almost quit the substance. He wasn't taking it. So yes, we do. Well, the only thing is they need persistence and a good willpower.
Okay, thank you. Case 3.
Case 3. Okay, anyone? Now, this case 3, I will tell about fibroids. Are you aware, everyone, what are fibroids? Have you heard fibroids?
What type?
You have not heard, Joseph? Fibroids?
I heard, what type? I mean, there's fibroids, there's like, I think there's different types, like all over the body.
No.
Like the ovaries, like different.
Yeah, yes. So fibroids.
Yeah, I have fibroids. Yeah, I have.
Yes. So I want, okay, first let me give you a 2-minute description of what is fibroid first. Fibroids are small, benign growth. They are not cancerous. Initially, they are not cancerous. 90% they are not cancerous, right? Why I'm discussing this is because 90% of females are advised to go for hysterectomy because of these fibroids, right? And you come across any such female, you should give them hope that please don't go for this. We have a good alternative thing, because going for a hysterectomy is a life-changing thing for the female entire life, right?
Yeah.
Because there is a disturbance in their hormones, in their bone health, everything, right? So therefore, I'm discussing this so that it will be helpful to you if you come across any such clients. Right now, these fibroids are small benign growths in the uterus. It can be outside the uterus, it can be on the ovaries, then it is mostly a cyst. But these are because of the influence of hormones. Female body has 2 hormones, estrogen and progesterone, right? Now their cycle, 28-day cycle, is divided into these 2 hormones. The initial half is mainly estrogen from day 1 to day 14, and then once they ovulate, it's the progesterone, high progesterone. But because of stress, irregular eating habits, anxiety, the hormonal imbalance creeps in. most in, if you know, in nowadays the female are more competitive, stress, success driven. It's good thing, but it makes the hormones a bit imbalanced, and there therefore they have a high estrogen, and the progesterone starts depleting. If the estrogen is more, then there is an increased circulation to the uterus, and therefore it gives rise to irregular lining in the uterus initially, and later on it gives rise to fibroids. Symptoms of fibroids. So this female, she herself is a doctor, allopathic doctor, and she had this 10 centimeter huge fibroid, and she came with severe pain, discomfort. Now the uterus, if you know the anatomy, the uterus is above, beneath is the bladder, the urinary bladder. Now because there is a fibroid in her uterus, the uterus tends to become heavy, and it puts pressure on the bladder, and they have this frequent urination, pain, discomfort. And during menstrual cycle, she had huge bleeding, excessive bleeding. She did a sonography. Her doctor advised to go for a hysterectomy. She's 45, 46. You know, she wasn't ready to do the hysterectomy. She said that I want to try some alternative therapy. And this she met me last year, January 21. It's been a complete 1 year now. She's with me. And the fibroid is pretty, 10 centimeter is pretty, you know, a big fibroid. And we started with the healthy meal because it was a COVID at time and we could not do panchkarma for her. So the thing, healthy meal detox, which you all must have done, the moong vegetable, we started with her. First month, we started with the herbs like fibron. Raktabandh is the herb which we give to cease that excessive bleeding, because that excessive bleeding need to be addressed, otherwise she would become anemic and low energy. So Raktabandh is the herb which we give to curb this excessive bleeding. Then, you know, some other herbs like Meta Boost and other herbs to balance their hormones. And, you know, in April, we repeated her ultrasound again. From 10 centimeter, it came to 8 centimeter in April. 2 centimeter in the 4 month, which is, you know, very, very difficult in case of fibroids. We are still doing this. In the last report, it was around 7 or 6. So her pain, her discomfort, excessive bleeding stopped within the first 3 months itself. So symptomatically, she was feeling good. But, you know, then we need to see the reports as well. And now it's shrinking. Her bleeding is normal, her cycle is normal, it's shrinking. And she has given up that she does not want to go for a surgery at all. Right? So in cases of fibroids where the allopathic gynecologist advise only for surgery, we can advise them to follow some diet, lifestyle, detox, and herbs, and then work on the fibroid thing. Right? Therefore, I shared this case with all of you so that, you know, if you come across anyone who have this, it will be helpful.
I have
Yes,
a question
and
on that.
have written, yeah. Doctor convinced me to surgery, even though not hysterectomy, made early menopause, couple fibroids into, you know. Yes, yes, I understand. But it is there. It is possible. Yeah, yeah, Jana.
So my niece had this, you know, she had the heavy bleeding for a year, and, you know, the doctors, I mean, she was working with it naturally with a naturopath, and she just generally decided to get a hysterectomy, and she's really young. She's in her 30s, and she connected with Ayashakti a little too late. You know, it was just in December, and in November, and she was planning on the surgery in December. But my question, she already had, yeah, she already did. She is working with Dr. Hamong. She's excited to see Dr. Hamong when he comes back. But my question is you said that you've been working with this lady that with the fibroids, excuse me, fibroids for a year, and she stopped the pain and the excessive symptoms within 3 months. How long generally? I mean, is she needing to work with this? Is this like a year, 3-year, 5-year thing?
Her size were like large, 10 centimeters are large. So she needs to take it for 2 to 3 years for, completely. See, again, the hormones play a role. It can increase also. If she's stressed, it can increase also. In between, she took some contraceptive pills. Again, it increased a bit, right? So it can increase and decrease, but in her case, she needs to take it for 2 to 3 years.
So in that situation, because I am very well aware of how the hormones get imbalanced, and once you start balancing them, then they become out of balance again. It's like they try to balance up. So how do you do that? I mean, do you meet with them more frequently to make sure that the hormone supplements are more in alignment, or how do you do that?
Even if, see, there are certain signs and symptoms of hormonal imbalance, plus you can evaluate through the pulse. So even if you meet in 2 to 3 months, that's fine, right? Because here in India, it's possible we can meet after a month and analyze. But then it is not, a major change is not noticed in a month's time. But then if you can advise them dietary recommendations, because if you are eating excessive gluten or excessive processed foods, right? These are the, even in plastics, they are also the plastic foods, yes, which we don't consider at all. The fertilizers, which we put in most of the grains and all, they are contributing this to the hormone things. Even the milk, the cow's milk, which we get, the cows are injected with the hormone injection for more production of the milk. Ultimately, it affects our hormones as well. So in fibroids, we tell them to avoid milk completely, because those milk are hardly of any nutritive value to her. So yes, the diet also plays an integral role here.
Okay, so you were saying to avoid excess gluten, avoid plastics, and there was one other thing that you said other than milk. Processed foods. Okay.
Tinned and canned foods.
Canned
the
foods.
foods which are just tinned, canned, kept, their shelf life is expired. They're dead food just for the taste, like chips and biscuits. They do not have any nutritive value.
Okay.
Right? So fine.
Dr. Priyanka,
yeah.
I'm sorry. So for that instance where the girl had the fibroids, right? And then she had either them taken out or hysterectomy, then they show up right away to you like, oh, I had that. I wish I didn't have the surgery. But then do you treat her the same way as though she had the fibroids, even though they were plucked out, or is it now different?
She did not went for surgery. She did not.
I'm just saying, if it like for Jana's niece, if, for example, or for me even, like, so I had the fibroids, they went in, they take them out and throw them in the trash.
The uterus was removed or the fibroids are removed?
Only fibroids.
Yeah, so then in that case, we still need to see that there is not recurrence of fibroids, because as I told you, it's a hormonal thing. We need to work on balancing the hormones. That's it.
And Dr. Priyanka, we have lots of estrogen in our water here because so much birth control pills, and then people pee it in. And then also the other thing I'm really worried about is when they're putting, so you know how like if you get a heart replacement, say I got a heart replacement from a man who loves to watch football and drink beer. And I hate to watch football and drink beer, but I get a heart transplant from him. Now I love football and I want to drink beer, right? So we know that that's possible, correct? But then I'm wondering if they put in tissue from another human in an injection in you, like fetal tissue. I'm a girl and I get a tissue of a boy, or maybe some boy, some girl, just mixed up tissue in now to my system. I've often wondered, how does that affect us hormonally in many ways? Why is that maybe why all of a sudden there's this new transgender thing? I just wonder, it's just something in all the estrogen in the water. How is that affecting us? You know, it's really, I think it has to have some effect.
Yes, there are multiple factors. Now you have two questions. One is some foreign tissue being injected into you and how your body reacts to it, right? That was your
Yes.
first question. And second question was of this artificial chemicals being used in the water and all, right?
Yes.
Now, the best thing is that, first of all, if you cannot prevent it, detoxify your body at regular intervals, eat healthy as much as possible, right? Second, if any foreign, see, even if you donate if simple thing is donating a blood, right? So something, if it comes into
Yes.
your body, some foreign object coming to the body's initial way is to just, reject it. That is the body's initial this thing. But gradually, if you have if your immune system and stuff is good, gradually, they accept the things in the body. And, even in the modern science, before transfusion, they check the compatibility, that the various tests have been done before this thing. So the reactions are very less likely, but if it is there, then definitely with a good lifestyle and, good eating habits, you can control them. You can control the reactions at least.
Gotcha. Thank you.
Fine. So yes, we had a good session. I think three things we discussed, three conditions, right, Arma? What are the three conditions we discussed today? GRD, fibroid, and renal calculi, right? And we know now in these three conditions, Ayurveda, Ayush Shakti, Siddha Veda has a good, foolproof, a good way of healing, rather than going through some other interventions, right? Other medical interventions or other treatments which might have a side effect in long term. So if any of you come across such things, it will be you now, because you know bit of everything. Now you have to enlighten people around you. Not necessarily everything, but just give them one thing, that stop drinking from a plastic, this thing, use an other glass or something. Stop drinking from plastic water bottles, right? One thing you can advise. Stop them. If you hear someone having a renal calculi, tell them eat less of protein diet, have more water. So small things, if you just help others and see how they are improving with this thing, that will be helpful. And obviously, if they have a bigger stone, like in case of Grace, then definitely we have herbs, we have detox procedure, which can help them. Right? Anyone want to share anything, or shall we just wrap it up?
It makes me
Yes,
sad, Dr. Priyanka, that they make it so difficult and complicated, and these things, surgeries, now you can die and have all these extra complications, and it's so simple. It can be so simple, and yet it looked like these things you're talking about. These are things that really destroy people's lives, and yet they can be so easily put back on track. And here, I got to tell you, here they don't do it.
but simple isn't profitable.
I'm sorry.
Simple isn't profitable. That's why it's not promoted.
I feel like I was like experimental guinea pig.
Very true. Very true.
I would just like to thank thank you, Dr. Priyanka, Dr. Naram, and your lineage, because I can't believe I'm here today. So thank you so much.
So grateful.
Okay, bye. Have a nice day. Bye, everyone. See you. And I want that 5 homework, 5 subtypes. Bye.
Okay.
Thank you.
Dr. Priyanka, what I sent you was not right then. I'm going to do it over.
Yes, redo it again. I will go through it. I did not have time today, but I will go through it and I will send you. Okay.
Do we need to upload?
Maybe.
No, you can send it to me private. No need
Privately.
This is for our group only.
Okay,
Right?
not to upload it on not to upload it on the G drive on the. Okay, perfect. Thank you.
Fine.
Thank God.
Bye.
Thank God.